Let's jump into the steps and activities that health departments and community-based organizations should take while engaging youth and young adults. Let's talk about power. First, health departments and community-based organizations must be open to giving up some power to allow youth to engage in a non-judgmental space. Youth are better able to vocalize their needs when they feel safe, brave, and comfortable in doing so. In initial meetings with young people, the message of young people holding power should be openly expressed and if needed, expressed continuously for reassurance. This will help to create a brave space for all young people who want to engage and be the voice for young people in their communities. The reality is that groups may not always be able to guarantee a safe space for all, but should make all efforts to create a space that is respectful and honest, especially for young people. Openness. Health departments and community-based organizations should recognize youth as experts in their own needs, acknowledge their feelings, and try to listen to understand and not to respond from a superior mindset. Working with health departments can be intimidating for young people, mainly because of the traditional imbalance of power between young people and adults who ultimately get to make final decisions. Provide affirmation. Young people are the future. Remind them that through positive affirmation. Overpromising. Is it important to mention to not overpromise and be intentional on why your health department or organization would like to engage youth and young adults? Inform them that the youth voice is missing from the AHG planning and that their feedback is both important and valuable in ending the HIV epidemic in the country. Do not promise to change the world overnight for young people, but instead be open about expectations and their roles in the engagement process. Overpromising. It is important to mention to not overpromise and be intentional on why your health department or organization would like to engage youth and young adults. Inform them that the youth voice is missing from their EHG planning and that their feedback is both important and valuable in an HIV epidemic in the country. Do not promise to change the world overnight for young people, but instead be open about expectations and their roles in the engagement process. Peer leaders. Health departments are encouraged to involve youth as peer leaders and as evaluators in the development and implementation of policies and programs. The end result of this co-collaboration is the creation of tailored services that meet young people's needs. Peer leaders have the advantages of designing innovative health-related programs that will attract young people to access these services. In addition, peer leaders can also learn from engaging with health departments and organizations and may choose a career path in the public health or medical sector. Equal partnerships. Similar to peer leaders, we should try to engage youth and young adults as equal partners in the EHG planning process. One example of this is to create youth advisory boards. I would like to mention that some states have been able to successfully implement youth boards with active participation from young people. Invite youth to join and equally participate on advisory boards and our teams designated to develop help programs for youth and the community. Create paid positions to make it more appealing for young people to serve on these boards and actively participate and contribute to these boards. This is why it's important during the internal process to determine what funding is available to incentivize young people to participate in your health department's health planning. Young people can use this opportunity to build their professional portfolio for employment in our college application. We always want to take the youth development approach. Health departments will want to have two separate boards, one for youth 17 and younger and another board for young adults 18 to 24. Boards must be developmentally appropriate for all ages. When recruiting and onboarding young people on these boards, make sure the young people on these formal boards represent the population of the youth folks in the community. This looks like including young people from the LGBTQ community, the Black community, Latinx community, the Indigenous community, and those youth with learning, mental health, physical disabilities, and those from the most disadvantaged and vulnerable communities. This will help to create more inclusive programming and intervention models that are sustainable. Rapport. Rapport. An easy and simple strategy to start to build relationships and rapport with young people is to ask what their preferred pronouns and preferred names are. Even if you get a young person's pronouns incorrect the first or the second time, generally apologize, recognize your mistakes, and make an active effort to remember preferred pronouns and names going forward. Ask questions and do not make assumptions. The youth development approach. When creating programs and services for young people, departments and community-based organizations should include the element of youth development and capacity building skills. These skills can include, but not limited to, building personal strengths and assets, promoting life skills, goal setting, and supporting academic achievement. Also include the elements of protective factors such as the family, healthy peer groups, school attachment, and academic performance in youth programs. This method supports healthy adolescent development and reduces long-term HIV risk behaviors. In addition, openly asks young people what should be included in any HIV-related programming developed for young people and young adults. The wonderful thing is that young people are more than capable of coming up with their own solutions. Referral and linkage. With the help of young people, create a unified referral linkage process that is able to effectively assess the needs of young people and connect them with the proper resources in their immediate communities. Ask young people what barriers exist in their current referral system, ask them for feedback on what is needed to improve access to referral and linkage services for young people of all ages. New and profound information may be provided during these conversations that can be brought back to your health department and our community-based organizations. More than ever, it is important for health departments and community-based organizations to meet young people where they are in their communities. This includes being flexible and creating spaces where youth feel comfortable, safe, brave, and affirmed. Spaces may include community centers, schools, and other youth-serving organizations young people tend to frequent in their communities. Incentives. Consider utilizing contingency management, using incentives and rewards to encourage young people to set positive goals that can help them to reduce risk factors. Contingency management helps to promote engagement and participation in youth programs and initiatives led by your health department or community-based organization. Also, if your health department and organization decides on hosting town halls and focus groups, provide incentives to show that departments value the time of young people. Social media. Lastly, health departments and community-based organizations should most definitely consider utilizing various social media platforms to engage young people. Social media platforms have the ability to reach a larger network of young people and young adults to share information, especially during COVID. Social media allows for folks to be creative, and allow young people and young adults to engage from the comfort of their bedrooms, homes, and reduces the complication of arranging transportation to engage in person. This can be simply a media campaign.